Hello everyone, today we will discuss about the topic of Corynebacterium. So morphology, they are the gram-positive, non-acid fast bacteria, non-motile, aerobic, club-shaped, non-sporulating and non-capsulated. They are pleomorphic, means they occurs in the various forms but occur in pair. So stain used to see this is Albert stain. It occurs in a pairs at small circular colonies with a V or L shaped. So here V or L shaped means this is bacteria like this V shaped. It occurs in pairs V shape or else the L shape in a colonies are formed. So virulent forms, they are the virulent forms. So the cultural characteristics, enriched media is required. So the media should be enriched with the blood or the serum. So pH should be maintained neutrally, that is 7.2, and media used for the culture is Loeffler's serum or terulite agar, blood agar. Okay. So this Corynebacteria, if you provide the terulite blood agar, it reduces the terulite to terulium, where we can see the gray or black in color. So the three types of the colonies can be found. The first one is a gravis, that is highly pathogenic form. Second one is a mitis, that is mild variety. And the intermediate forms, they are intermediate, like they produce the pathogenic activity in the intermediate forms. So the pathogenicity, they are the virulent forms. Toxin is the protein. Toxin is made up of the protein which is in a crystallized form. They are potent to causes the disease and they are lethal. Okay, so the molecular weight of the protein will be 62,000, which can be further divided into 24,000 molecular weight protein, and one will be the 38,000 molecular weight protein. So one which is 24,000 molecular weight protein, that will be involved in the enzyme activity, whereas one which is 38,000 molecular weight protein, that will help in the binding to the domain. So both are toxic, both causes the disease. Okay, so toxoid. So what is toxoid? It is a toxin, but the toxicity level will be lost in this we call it as toxoid. Okay, so it doesn't lose their antigenicity, but the toxicity level will be decreased, so it is capable of producing the antitoxin. Okay, so the resistance, they are killed with the heat treatment for 10 minutes at the 58 degrees Celsius and 1 minute for the 100 degrees Celsius. So they are resistant to freeze, means they won't dry when you freeze the organism, and destroyed by antibiotic and also the antiseptic. If you give this antibiotic and antiseptic, the organism will die. So antibiotics like penicillin, penicillin tetracycline, ciprofloxacin, etc. So the symptoms appears after 2 to 7 days of the infection. Symptoms includes like fever, chill, fatigue, sore throat, pain during the swallowing, and difficulty in breathing. So the main symptom is difficulty in breathing. Why? Because the soft tissues in the respiratory tract will be destroyed or damaged. Okay, so due to the destruction of the soft tissues in the respiratory tract, there is a difficulty in breathing as well as swallowing. So dead tissue which is dead during the damage of the soft tissues, so these tissues will form the gray colored thick mucus which is present in the nose and throat. So it damages the nose, tonsil, and massive swelling in the submandibular region also can be seen, and cervical damage leads to the bull neck. The transmission can occur through air, cough, sneeze, and the contact of the skin. Laboratory diagnosis, usually two swabs are collected. So from the lesion of the tongue, first swab is directly smeared and seen through the stain by the methylene blue stain. We can directly see in the microscope. But the second swab on we have to culture it on the terulite blood agar media. Okay, overnight at 37 degrees Celsius and incubate that at 37 degrees Celsius in aerobic condition. It produces the gray or black colored colonies. After once the colonies are formed, we are going to take that and take the loopful of culture, prepare a smear and gram stain the slide and observe under the microscope. So the treatment, for the treatment purpose, antibiotic therapy is recommended. So penicillin and erythromycin are the majorly used antibiotics for this Corynebacterium. Prophylaxis, the vaccination, which is the toxoid vaccination, is given against the diphtheria. So 3 dosage are recommended for the immunity purpose. If you like the video informative, do like, share and subscribe. If you want any videos such, do comment in the comment box. Thank you.